Good afternoon and welcome to the National Emergency Operations Center COVID-19 weekly briefing for the 17th of February 2021. I am Les Roy Williams. Thank you very much for joining us for today's briefing. Of course, we continue to update you in terms of what is happening in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic. And indeed, we have managed very well. We only have to look around us and on the news, and I think that St. Kitts and Nevis has done a very good job in the management of the pandemic. Of course, the pandemic has taught us that how fragile life can be and how unpredictable. Today begins the Lenten period, a very holy time in Christianity that focuses on prayer, fasting, and charitable works or almsgiving. So this is a period when we can reflect on what has been taking place globally with respect to the COVID-19 pandemic. It has really been a difficult time for many persons and a time really when we can reflect on life, what life is all about and the important things in life. And for those of us who go to church and who on today's Ash Wednesday and take the ashes, when the priest give you the ashes, you are reminded. Remember that you are dust, and to dust you shall return. Repent and believe in the gospel. Firstly, today we are going to have a presentation from Sabina Harina-Rain of Caribbean Lottery, who will make a presentation of 200 masks that she is donating to the Ministry of Health. Actually, it's 3,000 masks, 200 to the Ministry of Health, and 1,000 to the National COVID-19 Task Force. So I invite Ms. Harina-Rain to present the mask to the Ministry of Health, and I invite Dr. Cameron Wilkinson to accept the donation.
Good afternoon. On behalf of the Caribbean Lottery, we would just like to take the time to commend the efforts undertaken by the Ministry of Health as well as the COVID-19 Task Force in keeping us safe here in the Federation. To show our commitment to the cause, we would like to donate 2,000 of the KN95 masks to the Ministry of Health and 1,000 of the KN95 masks to the COVID-19 Task Force. We once again thank you so much and applaud all the hard work and effort that you have taken in keeping us safe, especially in these uncertain times. Thank you so much.
Sabrina, on behalf of the Ministry of Health and all of the persons in the Federation of St. Kitts and Nevis, I want to say how grateful we are for this timely and very important donation. We have said all along that it's the non-pharmaceutical measures that will keep us safe, wearing a mask, social distancing, and hand sanitizing, and we cannot have enough masks. I'm happy that your organization has decided to make this donation of 3,000 masks, 2,000 to the Ministry of Health and 1,000 to the task force. I assure you that these will go a long way in continuing to protect us and preventing the spread of COVID-19. We have done a great job so far, not having any community spread, not having any major hospitalizations or deaths, and this gesture today would go a long way in keeping us in a continued safe manner. So we thank you very much.
Thank you very much for that donation of 2,000 masks to the Ministry of Health. 1,000 will go to the National COVID-19 task force. So I make that correction. It's 2,000 masks, 1,000 will go to the National COVID-19 Task Force, 1,000 will go to the National COVID-19 Task Force, and 1,000 to the Ministry of Health. Thank you very much, Ms. Harina Rain of the Caribbean Lottery, for your donation. I now invite Superintendent Cromwell Henry, who will update us on the legislation pertaining to the prevention and control of the COVID-19 virus. Superintendent Henry.
Thank you very much, Mr. Williams. Pleasant good afternoon to all listening to this broadcast by whatever means. I would have previously indicated at an earlier briefing that the police were conducting investigation into breaches at the approved quarantine sites. On Monday 15th and Tuesday 16th February, the police arrested and charged 2 persons for violations at one of these sites. An American national, Mr. Giuseppe Macon Codo, he arrived in the Federation from the USA on January 31st and was quarantined as required by our protocols at one of these approved facilities. The investigation revealed that on that same day, Mr. Giuseppe left his room and went to the hotel's perimeter fence, where he met with his fiancée, Miss Amanda Chang, who is a Jamaican national who resides in Nevis. The two came into close contact at the fence, and this contact was captured on the property's surveillance system. The relevant authorities were informed, and the Ministry of Health conducted the necessary contact tracing, which resulted in 5 persons being quarantined for 14 days, including Ms. Chang. At the end of this quarantine period, Mr. Giuseppe was arrested and charged for breaching the conditions of his quarantine, and Ms. Chang was also arrested and charged for visiting a place of quarantine. They both appeared before the Bastille Magistrates Court on Wednesday 17th February, where they pled guilty to the charges and were both fined $5,000 each to be paid forthwith or serve 6 months in prison. At the end of the quarantine period, all the persons who were quarantined were tested negative for COVID-19, and we are thankful for this. Again, I take the opportunity to remind the public that visits to persons in quarantine, whether at home or at an approved facility, are prohibited under the COVID-19 Prevention and Control Act. And this is punishable by a fine of not exceeding $5,000 or 6 months in prison, or both. I will advise that if you wish to deliver supplies to a person who is in quarantine, you must report to the on-site security who would make the delivery on your behalf. No person is allowed to visit any person who is in quarantine, and we ask that you be guided by this particular regulation. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief, Dr. Cameron Wilkinson, our Medical Chief of Staff, to give us a presentation. Dr. Wilkinson.
Thank you very much, Ms. Y. As we have heard, the vaccines are around the corner, and we thought it was important for us to speak to you, the general public, as regards the importance of vaccines and vaccination. Now, what is a vaccination? It's a simple and safe and effective way of protecting people against harmful disease before they come in contact with them. It uses your body's natural defenses to build resistance to specific infections and make your immune system strong. In other words, you're able to fight these diseases and not get sick. So vaccines train your immune system to to create antibodies or proteins, just as they do when they're exposed to the disease. The vaccines contain only killed or weakened forms of the germs, that is the virus or bacteria, and do not cause any significant risk or complications to the person who is receiving the vaccines. Now, most vaccines are given by injection, some are given by mouth, and some are given by nasal spray. The COVID-19 vaccine will be given by injections. We know that there are a number of persons in our community who are afraid of needles, but it's just a little stick that you will get to save your life, and so please don't run away just because of a little needle stick. Now, some persons may ask, why is it important to be vaccinated? Today, there are vaccines available to protect against at least 20 diseases, and some of them we know about them because we would have been vaccinated against them as children: tetanus, pertussis or whooping cough, polio, and measles. As a matter of fact, vaccines save over 3 million lives each year. And when we get vaccinated, we are not just protecting ourselves, but we are protecting those around us. We see here in the image I have projected leaders from the UK and the United States who are taking their vaccines, and very soon, the next time I give this presentation, we'll be having persons in leadership positions right here in the Federation who would have been rolling up their sleeves to take the vaccine as a lead for you, the general public. Now, it's not everyone who can take a vaccine. There are some persons who, if they're seriously ill, very young babies or people who have severe allergies, they may be advised not to take the vaccine, and they depend on the rest of us to get vaccinated to help reduce the spread of the disease to them. Now, we are not reinventing the wheel. As I said, there are over 20 diseases that persons would have received vaccinations for, and that's a list of some of them. We know about polio, rabies, rubella, tetanus, typhoid, yellow fever, mumps. And so COVID-19 is just another one that will be added to the list. Now, we have spoken about the concept of herd immunity. When a person gets vaccinated against a disease, their risk of infection is reduced. So they are also less likely to transmit the disease from one person to another. And the more people in a community who get vaccinated, the fewer people remain vulnerable, and there is less possibility of an infected person passing the pathogen on to another. And so, for example, if all of the persons at our ports of entry and the frontline workers were vaccinated and they came in contact with an infected person, the chance of they taking that infectious agent home and reinfecting other persons is significantly reduced. Therefore, lowering the possibility of the pathogen circulating in the community when we get vaccinated. So herd immunity is the indirect protection from an infectious disease that happens when immunity develops in a population, either through vaccination or through previous infection. Because COVID-19 is so deadly, we don't want to get immunity through infection, and we also do not know how long the immunity lasts when you get an infection. Therefore, the safer way of protecting yourself is by getting the vaccination. Now, we know that there are a number of vaccine trials out there. There are over 60 COVID-19 vaccines undergoing trials right now. However, despite the fact that there are so many vaccine trials, there are only a few that have been given emergency use authorization. And it means, therefore, that the protocols and procedures in place before a decision is made for them to be placed into the arms of the general public is very, very strict and very rigid. And so once a vaccine comes on the market for use, it means that it would have gone through significant rigorous testing and is therefore safe. The World Health Organization has been working in collaboration with a number of other agencies to accelerate the development of these vaccines so that we can address this pandemic, which is very deadly, and bring it to an end. The speed, therefore, at which these vaccines are being developed is not because of any shortcuts, but because of significant financial investment that was made into their development and also advances in science and technology. We have heard about the first two vaccines that came on board, the Pfizer-BioNTech and the Moderna, and these are mRNA vaccines where a protein is injected and make the person develop the protein that is present on the COVID-19 vaccine, on the COVID-19 virus, and then you can develop antibodies to this and protect yourself. The protection offered by these vaccines is over 90% for both of them. The Pfizer vaccine is given 3 weeks apart, the Moderna 4 weeks apart, and they're indicated for persons over the age of 16 and 18. The problem with these vaccines is that they require special storage to maintain the cold chain. The Pfizer is stored at -70 degrees and the Moderna at -20, -30 degrees. Now, the regular refrigerator goes down to 4 degrees, and you can see then that if one were to use these vaccines for worldwide vaccination, you would require special storage, and a number of third world countries would have great difficulty in getting that sort of storage. Therefore, the quest for more vaccines that were easily available continued. The other one that came onto the market was the University of Oxford, AstraZeneca, and this is a vaccine that is also injected. The protection is between 70 to 90%, which is less than the first two that I mentioned. However, when I speak about vaccine efficacy, you will see in the long run, this might not really matter. The doses can be given up to 4 weeks or even longer. They are advocated for persons over the age of 18, and it can be stored at refrigerator temperature between 2 to 8 degrees for up to 6 months. The other vaccine, Johnson & Johnson, that has not yet received emergency use authorization, but has great promise because it's a one-shot vaccine, and therefore, once somebody gets one shot into the arm, there is no issue with trying to follow them up 3 or 4 weeks later to get the other shot. And most experts think that this vaccine, once it gets emergency use authorization, is the one that would be used most widely around the world because it also requires storage at a refrigerator temperature and no special deep freezing to keep it safe. Now, this comes to the issue of vaccine efficacy, because sometimes persons will look at the absolute numbers and they see that the Pfizer-BioNTech is 95% effective, whereas the AstraZeneca might be between 70 to 90, and they might say, well, I would want to get the Pfizer-BioNTech as opposed to the AstraZeneca. Now, what is vaccine efficacy? Vaccine efficacy is the percentage reduction in disease incidence in a vaccinated group compared to an unvaccinated group in a clinical trial. Now, it's important for you to know that in a clinical trial, there are special exclusion criteria. In other words, we don't do clinical trials on little babies or the very old and the frail. And so most persons who enter into a clinical trial would be relatively healthy young adults. So the exclusion criteria might be age, pregnancy, or particular health conditions. Now, once the vaccine goes to market and is being put into a person's arms, the persons who would be receiving the vaccine would be quite different to those who were in the clinical trials. And so the ideal conditions of a clinical trial do not necessarily reflect what happens in the real world. And the vaccine effectiveness tells us how well a vaccine works under real-world conditions once persons outside the clinical trial receive the vaccine. And this will also depend on a number of things like the person's age, if they have any comorbidities like diabetes, hypertension, coronary artery disease, previous exposure to the disease, how long since they were exposed to the disease or vaccination, and also the development of variants. For example, we recently heard about the development of variants and the fact that some vaccines may not be as effective in limiting mild disease against the variants. Now, it's important then for us to understand what is a variant and not be too surprised when we hear about the development of variants. When a virus makes copies of itself, it's sometimes changed a little. And when I say makes copies of itself, when one becomes infected with the virus, it multiplies within your system, and so it's making copies of itself. And as long as the virus is circulating for some time, we will have little changes occurring on the surface. And the changes that occur where a new virus that is slightly different from the previous one develops. These are called variants. Now, these changes, when they occur, makes the virus more adaptable to its environment. And so the changes can result in increased transmissibility of the virus or increased severity of the disease. The known variants that we know of now, they have an increased transmissibility, but there is no documentation that they have an increased severity. However, once you have a virus that is more easily transmitted, it means that you may have more persons coming down with the infection. And if you have more persons coming down with the infection, the healthcare system can become overwhelmed and you can have an increased death, even though the severity of the disease caused by the variant is not significant. And so it's important, therefore, for us to do everything that we can to keep the variants out of our tiny federation. Now, when we speak about the efficacy of the COVID-19 vaccines, it's important for us to also look at the efficacy of previous vaccines. For example, there are very few vaccines that reach 100% efficacy. You need to move forward on the slide. Yes, there are very few vaccines that reach 100% efficacy. The flu vaccine, for example, there are many persons who take the flu vaccine each year, but you'll be surprised to learn that the efficacy has been as low as 10% in 2004 and as high as 60% in 2020. And the average efficacy of the flu vaccine ranges between 40 to 60%. Last year, it was 45%. Despite the fact that these figures might sound pretty low, the effectiveness at controlling the flu was quite significant. Therefore, you cannot just look at a little 5 or 10% difference in efficacy of vaccines and determine that you will want the one with the higher efficacy. If we look further down the slide, for example, mumps, the efficacy is 88%. However, none of us in the last 10, 15, 20, 30 years have seen someone in St. Kitts with mumps since we started the widespread immunization of mumps, despite the fact that the efficacy is only 88%. And so there are very few vaccines that reach an efficacy of 100%. Tetanus and polio, after you have completed your doses, they have an efficacy of over 100%. Now, some persons ask, who will be vaccinated first? The recommendations by the World Health Organization has 3 goals in mind. 1, to decrease death and serious disease as much as possible. 2, to preserve a functioning society, which means that key persons in the society important for its functioning have to be vaccinated. And 3, to reduce the extra burden COVID-19 is having on people already facing disparities, which means that persons who are disadvantaged, persons who are in close clusters, low-income families where they are in areas where they have to be bunched close together, these persons have to be given priority. So the criteria, it's quite broad, but very important. Now, I will speak just briefly as to the phased approach from the World Health Organization, and when Dr. Hazel-Laws comes to speak, she will speak specifically about our criteria, because we have learned all along that there is no one-size-fits-all approach, and this approach that was outlined by the World Health Organization was addressing mainly countries that had community spread. But we do not have community spread here in St. Kitts and Nevis, and so our focus should be more on strengthening our borders and making sure that there is no importation of the virus. So the rollout should be phase 1A, which are healthcare personnel and persons in long-term care facility. Phase 1B, mainly the frontline workers and persons over the age of 75, because these persons are at higher risk for hospitalization, illness, and death from COVID-19. And phase 1C, once we've vaccinated the persons above age 75, persons between the ages of 65 and 74, and people between the ages of 16 and 64 with underlying health conditions, and any other essential workers who were not included. The ultimate goal, however, is to have everyone vaccinated. But while we're moving towards this goal, and don't forget, our plan here in St. Kitts is to have more than 70% of the population vaccinated. But while we're working towards this goal in having a safe, effective, and fair rollout of the vaccine, we must continue the essential public health action measures that we know to suppress the transmission of the disease and reduce mortality. Some persons also ask, you need to move forward. Next. Some persons also ask, should the vaccine be mandatory? Now, to be properly protective, COVID-19 vaccine needs to be given to most, if not everyone, because it's only through widespread vaccination will we reach herd immunity. And being vaccinated, we know, significantly reduces your risk of getting severe disease and death, and also significantly reduces your risk of spreading the virus to someone and harming someone. Now, this, by you getting vaccinated, it's at a minimal cost to you and society. The alternative would be community spread and lockdowns, which would cause great which will come at great cost, not to just you, the individual, but to society. We, however, believe that we can achieve herd immunity through less stringent measures, such as a campaign of education and making sure that everyone buys onto the idea of getting a safe vaccine in their arm to prevent the spread of COVID-19. We are always asked then, if someone is vaccinated and they come to St. Kitts now, will they still need to be quarantined? The decision lies in your hands, because until we get to a state of herd immunity, we will have to continue quarantining persons who come into the Federation, because being vaccinated doesn't necessarily mean that you cannot spread the disease. Being vaccinated protects you from getting severe disease and death, but you may be asymptomatic or you may have mild disease, and during that period you may still transmit the virus to someone else. And so while we remain virgin territory with no exposure to disease, until we get herd immunity, we would have to continue with these protocols and procedures. Some persons may ask, if I got COVID-19 already, should I be vaccinated? The vaccine should be offered to everyone regardless as to whether or not you had previous infection. However, if you are currently having an infection, it is best to wait until after the infection is resolved before you are vaccinated. Also, studies have shown that persons who had the infection, they have some degree of immunity, and the chance of them getting another infection within 90 days of a previous infection is significantly lower. So once there is a vaccine shortage, these persons can wait and let other persons who have no immunity at all step out of the line and have the vaccination. Persons have asked whether or not the vaccine is recommended for pregnant women. Now, pregnant women who contract COVID-19 are at increased risk of poor outcome. In other words, they're more likely to have severe disease and probably even death. The World Health Organization therefore advised that those who are at high risk of contracting the virus through work or having underlying health conditions which predispose them to develop complications from the virus should take the vaccine in consultation with their doctor. Although available data does not indicate safety concerns, there is insufficient evidence, however, to recommend routine COVID-19 vaccination of pregnant persons. And so here in our federation, we will not be routinely giving the vaccine to pregnant women. And if we have a pregnant woman who's working on the front line, that would put at risk for getting COVID-19 infection, and the prudent decision would be to put them into a safer job position so that they would not be exposed to the virus. Now, lastly, some persons will ask, well, with the vaccine here, and hopefully we'll be having our mass rollout sometime soon, how quickly will we see the end of this pandemic? And we say no one is safe until everyone is safe. And that is one of the reasons why the World Health Organization is attempting to have 20% of the entire world population immunized, whether their economic activity, whether or not you're rich or poor. Because the ending of the pandemic depends on a number of things. Number one, how effective vaccines are, and we know that the vaccines that are being rolled out, they are pretty effective. How much can be produced and get into the arms of persons, because having a vaccine in a refrigerator is not going to be effective. We need to make sure that people come forward and have it in their arms, because that is the only how we can achieve herd immunity. So we need to have as many persons coming forward to get vaccinated. Here in St. Kitts, because we've been functioning in near normalcy, because we do not have community spread, there's a sense of complacency that is stepping in, and there's some vaccine hesitancy. But I want to warn you that complacency and inaction can be just as deadly as the virus itself. The number of cases and deaths in the United States is beginning to drop. The vaccination schedule is increasing, and the President of the United States said that he hoped by the end of July to have the entire USA vaccinated. I can assure you that once the cases drop in the United States and once they have their population vaccinated, they'll be making rules and regulations to limit travel to persons who do not have the vaccine. And it's important for us to continue the journey that we have and move forward towards successful herd immunity in St. Kitts and Nevis, so that we would have gone through this pandemic without a single death, because every life is important. Thank you.
Thank you very much, Dr. Wilkinson, for that comprehensive presentation on the importance, the reasons why we should take the vaccine. I now invite our Chief Medical Officer, Dr. Hazel Laws, who will present us with the Health Emergency Operations Center Situation Report. Dr. Laws.
Thank you, Mr. Williams, and good afternoon to everyone. This afternoon, it's my task to share with you the HEOC Situation Report. As at today, February the 17th, we have, or the Federation has reported 41 confirmed cases of COVID-19, 29 cases St. Kitts, 12 cases Nevis. 39 of these 41 cases have recovered fully, and at present we have 2 active cases. They are in isolation, they are stable, and they are being monitored. Between last year, January 2020, and the present, over 109.1 million persons have been confirmed with COVID-19 globally, and over 2.4 million persons have died internationally as a result of COVID-19. 27.8 million of these confirmed cases were reported by the United States of America alone. 488,100 of these deaths were reported by the USA alone. In the Caribbean region, over 503,000 individuals have been confirmed with COVID-19, and over 7,300 persons have died from this disease. In the islands, in our neighboring islands, Antigua, 443 persons have been confirmed with COVID-19. In Barbados, over 2,331 cases. In St. Lucia, over 2,549 cases. In St. Vincent and the Grenadines, over 1,457 cases. Just this afternoon, another batch of students affiliated with the Ross University School of Veterinary Medicine would have landed on a charter from Miami A total of 84 students would have come in today, and they are going to be in quarantine at the dorms on the RUSVM campus. They will be tested tomorrow upon arrival. They arrived today, but they will be tested tomorrow. They will be in quarantine for 14 days. They will be tested again on day 14, and once their results come back as negative, then they will be released from quarantine and be allowed to integrate into our society. On Friday this week, another charter will come in from Puerto Rico with an additional 9 students. So far, we've tested over 8,625 persons, and as I said before, we've only reported 41 positive cases, so that gives us a positivity rate of about 0.4%. So, as I said before, 39 persons have recovered, so we only have 2 persons in isolation and over 398 persons in quarantine in a facility, and 10 persons in who would have chosen private quarantine at home under security, commissioner prescribed security. Now, St. Kitts and Nevis, we are preparing to implement or roll out our COVID-19 vaccination campaign or plan. And so, in terms of, so my task this afternoon is to provide you an overview of our national COVID-19 vaccination, deployment, and implementation plan. So I'm going to speak to access to the COVID-19 vaccine. I'm going to speak to distribution and then acceptance. Access. And so the Federation has signed on to the COVAX facility, which is a global mechanism that provides us access to COVID-19 vaccines. And so we would have received a letter about 2 weeks ago telling us that we would be allocated vaccines from AstraZeneca Oxford. And then 2 or 3 days ago, we received another letter confirming that the AstraZeneca Oxford vaccine has now been granted emergency use listing by the World Health Organization and is thus authorized for distribution under the COVAX facility. Our allocation of about 21,600 doses will provide coverage for approximately 20% of our population. And we have been told that during the week of February the 22nd, we will receive further information regarding our final allocation of doses to be provided between now and May of this year. Towards the end of last week, the Federation would have received a generous donation of 2,000 doses of the AstraZeneca Oxford vaccine, 2,000 doses from Dominica. The Federation is seeking access to further COVID-19 vaccines through other mediums or mechanisms. Access to the COVID-19 vaccine is crucial to curbing the spread of this pandemic and restarting our own economy and economies in the region and globally. Distribution. Now, in terms of vaccine cold chain, in St. Kitts and Nevis, we are presently improving and expanding our storage capacity for vaccines at the central medical stores at the JNF General Hospital and at Alexandra Hospital. And so these would be our principal storage points, but then vaccines will also be transferred to the Poxon Hospital and Mary Charles Hospital, where we have generators. And then on the vaccination days, vaccines will be transferred from these storage points to the point of service delivery, or the vaccination sites. So in essence, the health centers are the designated vaccination sites. So yes, in St. Kitts, 11 health centers, Nevis 6 health centers. These health centers will be deemed our vaccination sites. So at present, the Ministry of Health, we are ascertaining our state of readiness for the rollout of the COVID-19 vaccine. And so each health center is tasked with ensuring that they have adequate supply of, syringes, needles, alcohol swabs, etc., everything that would be required to administer this vaccine safely to our people. Training. Our community health team, meaning our nurse managers, nurse assistants, they are being trained in terms of vaccine administration. So Pan American Health Organization is providing us the technical support in this regard. We have been advised that we should use an appointment system, and so individuals will be given appointments, dates and times when to come in for their vaccine. Prioritization and targeting. So as I said before, we have been allocated about 21,600 doses. We've received 2,000 doses last week. And so at present we have coverage for approximately 20% of our population. And so we are going to have to prioritize and target the priority groups in the initial stages. And so the National Immunization Committee would have met and determined the target groups for the various stages. And so we will roll out this plan in 3 stages: stage 1, stage 2, stage 3. And I will give you an overview of the priority groups in each of these stages. And so in stage 1, we have stage 1A, healthcare workers who are working in the front line. This includes all the specialists, internists, doctors and nurses working on the COVID-19 wards, St. Kitts and Nevis, the operating theaters in both islands, ICU, emergency room, and all the nurse managers and the nurses who go and take samples at various quarantine sites and at the hotels, and also the personnel working on the ambulances. Stage 1B includes the border protection staff working on the front line along the corridor of containment. So this includes port health staff, immigration, customs, ground transportation, and hotel workers on the front line. Stage 1C includes the executive arm of government and essential workers outside of the health sector, and these include police and defense force, coast guard, fire and rescue. We will also look at or target older adults with chronic diseases, meaning those chronic conditions that places them at higher risk for severe COVID disease. So that means older adults with diabetes, respiratory conditions like emphysema, asthma, renal disease, and autoimmune conditions and coagulopathies. We are also advised to have an emergency reserve of vaccines for utilization in the case of an outbreak, meaning clusters or even community spread. So these are the target groups for the first phase of our rollout of our COVID-19 vaccination. So in terms of stage 2, I'm going to describe the priority groups in the second stage. Healthcare workers who are at moderate to high risk, and these include those working in nursing homes and home care services, laboratory staff, etc. We are also targeting older adults with no or one comorbidity. We are also looking at persons under 60 years of age with chronic diseases, so that the middle age group with chronic diseases. And then we are also going to be targeting socioeconomic groups, including low-income migrant settlements, disadvantaged persons registered in the social security benefit systems, persons with disabilities, low-income groups, hard-to-reach populations, and persons with mental disease. So these are the target groups for stage 2. Stage 3, we will be targeting all the staff and teachers in the Ministry of Education from the early childhood phase to the tertiary level. And then we will also target essential workers outside of the health system. And these include municipal services, other civil servants, persons working in agriculture, the food industry, ground and sea transportation, etc. We will also target social employment groups like prison workers and residents, persons working in the manufacturing industry, persons at New Horizon Detention Center, Children's Home, and the offshore medical school dorms. We are going to also include all other persons in the society in this phase, or in stage 3. And so this would include all our young adults and middle-aged adults who may not have any chronic illness. And so based on the target groups I would have described, everybody in our society would be covered. At present, the Ministry of Health is collaborating with the IT department in developing a registry which will be populated with the names of the individuals in the various target groups I would have just described. And we are also developing a database whereby we will be able to monitor vaccine safety. So in other words, once you would have received your COVID-19 vaccination, we are going to follow you up for a minimum of 3 months. So it's going to be 3 months and more, just to make sure you, or to capture any of the side effects that you would have experienced having received the vaccine. And we are going to capture this data in our database. Now, once you would have received the vaccine, you will be issued a COVID-19 vaccination card. And so once you've gotten your first dose, your card would state dose 1, date, you will be given an appointment for your second dose. Once you would have returned for your second dose, it would be recorded, and so your vaccination card will be given to you, and so you can use it as needed. The Ministry of Health has also developed a comprehensive communication strategy, and this is important because we must inform the public, educate the public about this vaccine. And education and communication of this nature precedes any rollout of any vaccine. And so it's our job to provide you, the general public, with the facts as we know it about COVID-19 vaccine. We will provide you the facts such that you can make an informed decision and accept the vaccine. We intend to use the traditional media and digital media platforms. And I want to use this opportunity to invite volunteers, advocates who want to work with the task force and the Ministry of Health in staging an effective public education campaign about COVID-19 vaccine. We cannot do this alone, and so the task force and the Ministry of Health, we want to engage the key stakeholders, meaning those within the government and those outside of the government, in the private sector, NGOs, civil society organizations, to come on board. From last year to present, we've used an all-of-society approach in our response to COVID-19, and it continues. And so we need your help in order for us to successfully roll out this COVID-19 vaccine campaign. And in order for us to be successful in achieving the herd immunity threshold, we need all hands on deck. In terms of the regulatory framework, we are collaborating with the Attorney General's chambers in making sure all the T's are crossed and all I's are dotted in terms of our regulatory framework. And of course, we can't accomplish much without adequate resources and funding. Okay, so as I said before, we would have received 2,000 doses of the AstraZeneca Oxford vaccine, and then the COVAX facility has indicated that we will be allocated this vaccine, the AstraZeneca Oxford vaccine. And so I want to use this opportunity to provide you additional information about the vaccine that will soon become available to you. It has an efficacy of about 63% against symptomatic COVID-19 infection, and then WHO has confirmed that this efficacy is increased up to about 82% if the second dose is given within 8 to 12 weeks. So in other words, if you receive the AstraZeneca Oxford vaccine, you have a 63 to 82% risk reduction in terms of your picking up symptomatic COVID-19 infection. This is what this really means. So there will be a 63 to 82% risk reduction in your picking up symptomatic COVID-19 infection. It requires 2 doses. The vaccine is stored in a regular, normal refrigerator at about 2 to 8 degrees, and we can store, the vaccine can be stored adequately in this condition for at least 6 months. We will be giving this vaccine to persons 18 years and over. And so if you are in one of the target groups I would have mentioned in stage 1, you will be given an appointment. You will be asked to come into the health center nearest you, and then you will be given a tiny injection. It's just a small dose, 0.5 mils, one dose, 0.5 mils, and as an intramuscular injection in your deltoid muscle. You will be given an appointment to come back in 10 weeks to get the second dose. When you receive the vaccine, you will be asked to remain seated for about 15 minutes, for at least 15 minutes after the vaccination, just so that you can be observed, and once you are free of any side effects, you'll be free to leave. So this is just an idea as to what will happen when you go in for your vaccine. Now, what's the ultimate goal? As vaccine availability increases, we hope that there will be recommendations to expand and include other groups, like the younger, like the teenagers. Now, our goal is for everyone to be able to easily get a COVID-19 vaccine as soon as large enough quantities of the vaccine are available. While we work towards rolling out a safe and effective vaccine, we must continue the essential public health actions that are needed to suppress transmission: wearing of the face mask, hand hygiene, physical and social distancing. Now here comes the big question. And I think we all have to ask ourselves the big question. Can you go back to that slide for me, please? If you were given a choice of, well, you will be given a choice of receiving or choosing to receive the AstraZeneca Oxford vaccine. So that's one choice you will be given. Or be exposed to the COVID-19 virus. Which would you choose? I have chosen to take the AstraZeneca Oxford vaccine. Why? if I were to contract the disease, one of 5 things can happen to me. I can recover without any symptoms, or I may develop mild symptoms, maybe a cough, runny nose, stuffiness, and then recover. I can become moderately ill and recover. I can become severely ill, even end up on the ventilator, or I can die. Now, if I opt to take the AstraZeneca vaccine, the scientists and the clinical data assures me that I'll be protected from severe disease and death from COVID. And so, ladies and gentlemen, I'm going to choose the AstraZeneca Oxford vaccine. What are you going to choose? And so this is a question that we all have to ask ourselves. I want us to be informed and make an informed decision. Hashtag, get the facts, get the AstraZeneca vaccine. And even when we vaccinate our people, even when I receive my vaccination, we are going to have to continue adhering to the public health measures of wearing our face mask, maintaining adequate hand hygiene, and maintaining a safe distance from others when in public. We will have to continue these essential public health actions until a significant proportion of our population have developed immunity against this virus, until a significant proportion of our population have received the vaccine. So, ladies and gentlemen, if you choose to take the vaccine, you're choosing the vaccine to protect yourself, and it's also a choice to protect the people of the Federation. Thank you.
Thank you, Dr. Laws, for that comprehensive report. I too choose to take the AstraZeneca vaccine. I now invite Mr. Abdias Samuel, who is chair of the National COVID-19 Task Force and National Disaster Coordinator, to give us the NEOC report. Mr. Samuel.
Thank you, Mr. Williams, and good evening to all who are listening and watching via the various media means. Today I want to use a comparative narrative to be able to give my briefing. Now, you would have heard the discussion on vaccine, and that's the stage where we are right now, vaccination. We have been talking about vaccines for a good while now. How do we reach the ending of this pandemic, or how do we end this pandemic? Now, I want to focus today on 2 critical countries, that's the UK and the United States of America, because these are the 2 source markets for our tourism product. Now, the UK at present, if you look at the presentation, is under a lockdown, and the lockdown has shown that it has decreased significantly the number of coronavirus cases they are experiencing on a daily basis. Now, in the United Kingdom, if you look at the presentation with me, you see that the England is on lockdown until the 22nd of February, Scotland until the 1st of March, Wales until the 19th of February, and Northern Ireland just extended their lockdown until the 5th of March. Now, what are the lockdown rules? And it's important for us to understand these things, because we have been advocating against going back into any lockdown. So the lockdown rules in the UK, they are saying, hey, stay at home. Only essential workers will leave. Only for essential services you will be allowed to leave your home. Again, exercising outdoors, that is restricted. Going to schools are closed. So we have gone to online educational classes. No household mixing, indoors or outdoors, unless you support or unless in your support or childcare bubble. So you know we have been creating bubbles and talking about these bubbles. No essential shops, leisures and entertainment. Pubs and restaurants have been closed. In St. Kitts and Nevis, we have been enjoying life to some sort of normalcy by having all these things that have been in lockdown in the UK opened. Now, I want to highlight, as per the presentation, what the lockdown has done in the United Kingdom, which is critical, is encouraging. If you look at the total deaths, what they're experiencing, for the last 2 months, it has been trending down. That's encouraging. The total cases has been trending downwards as well. And if you look at the number of persons in hospitals, that too has been trending. And what has been trending up though, which is critically to highlight, is the vaccination program. So you are looking at over 14 million persons in the UK have been vaccinated. So it shows that the vaccination program is rather successful. So again, if you look at the rollout, the UK rollout, the 15 million persons in the UK have received at least 1 dose of the coronavirus vaccine, and they are using both the Pfizer and the AstraZeneca, as mentioned by the doctors previously. The speedy rollout, which is critical, the speedy rollout of the vaccine to all vulnerable people is seen as critical to reducing the pandemic. So we have to move as well here in St. Kitts and Nevis with speed. It's critical if we want to reach a state of normalcy and achieve the goal of herd immunity. It says that from spring, the government of the UK plans to vaccinate the rest of the population, some 21 million people. In St. Kitts, the CMO just outlined how the groups and stages will go in terms of vaccination. Now, if you look at this slide, you will see that the vaccination process started a bit slow. However, you have seen that in the last 2 months, that's January and February, you have seen a significant increase in the vaccination process, if you take a look at the slide. So people getting vaccinated is one of the critical ways in which we will reach an end to this pandemic. So if you look at doses per country in the next slide, please. Right. You will hear the stories of Israel. According to the BBC, the Israel, United Arab Emirates, the UK and the US are the 4 top countries rolling out the vaccination process. So vaccine doses per every 100 persons in these countries are the highest. In St. Kitts and Nevis, we want to achieve the goal of being one of the highest and the fastest vaccinating countries in the OECS. And I think we can achieve that. We have achieved much, and we can continue to achieve more. I want to highlight what the Health Secretary of the Office of National Statistics in the UK would have said. He said that the figures were clearly good news, but pointed out that there were still more than 24,000 people in hospital with COVID-19. He further said that everyone can have confidence that the plan is working, that we are collectively doing, what we collectively are doing is having a positive impact, but there is still a long way to go. The UK senior statistician, Sarah Croft, said the rates of infections remains high, but have continued to decrease in England and across the UK. So one of our source markets, such as the United Kingdom, is doing a lot in order for them to reach an end to the pandemic. We here in St. Kitts and Nevis, in particular, our people working in that particular sector, and being a country that relies on tourism, we need to exercise that level of responsibility as well, and feel encouraged, as they are doing in the UK, to also take the vaccine and do what we need to do to bring an end to this pandemic. Now, I want to move over to the United States. In the United States, they have seen a downward trend in death from COVID-19 as well as cases in COVID-19. In the month of December and January, there was a high spike in cases, and these are cold months. However, the new president would have introduced a 100-day mask wearing mandate, as well as a ramp-up of the vaccination process. What has been the result? A significant downward trend in cases per day and death per day that is being experienced. So therefore, doing these things has proven that in our source markets, the cases and deaths are trending downwards. So I want to highlight 3 particular states, and that is in the northeast of the United States and in the south. Let's take a look at New York City. In New York, 3 weeks ago, they were experiencing 12,859 cases per day. 2 weeks ago, the trend was 11,152. Last week, it has gone down to 8,670. And this week, we have seen that it continues to decrease to 7,949. So this is critically important. Let's look at Florida, Miami. Most of us travel to Miami for vacation and everything else. So 3 weeks ago, Miami, Florida was experiencing 11,338. 2 weeks ago, 9,982. Last week, 7,586. This week, it has trended downwards to 6,649. What does that mean? That all these measures that are being put in place have been working in order to decrease the cases. Dr. Rochelle Walensky, the director for the Center for Disease Control and Prevention, said on NBC's Meet the Press on February the 15th, it's encouraging to see these trends coming down, but they are coming down from an extraordinarily high place. All of it really wraps up into all of it is really wrapped up into we can't let our guards down, Walensky said. We have to continue wearing masks. We have to continue with our current mitigation measures. We have to continue getting vaccinated as soon as that vaccine is available to us. The vaccines are becoming available to us here in St. Kitts and Nevis, and we need to take the vaccine. So, what happens when an outbreak of COVID-19 occurs? And I am going to make comparison to 2 Caribbean islands, Antigua and Barbuda and Barbados. Barbados is presently on a lockdown, and Barbados has experienced or will be experiencing, according to the Honorable Mia Mottley, Prime Minister for Barbados, a $150 million in loss to the economy. And so these figures are very important for we to understand that we have to continue with the measures that are in place in order for us to reach that state whereby the vaccine can help us to reach a state of normalcy. Let's take a look at Antigua and Barbuda, who has gone, as of yesterday, into a state of emergency with curfews from 6 p.m. to 5 a.m. in the morning. Now, they have 270 active cases. 270 active cases and increasing on a daily basis. And they would have had to now slow the transmission of the virus by putting restrictive measures in place to ensure that they curb this transmission. So, what have they done? State of emergency, curfew imposed, and here we see the Royal Antigua and Barbuda Police Force encouraging persons that we can do this. In St. Kitts, we don't need to do this because we need to ensure that we keep the gains that we have made. So how do we mitigate the impact of COVID-19? We have to continue with the public health campaigns, increase the knowledge about transmission, the treatment and the vaccine that we are going to be we have accessed some, and those that we'll be accessing, and continuing to the adherence to non-pharmaceutical measures. How do we bring the end game to the COVID-19 pandemic? And this image, as you see in the presentation, you see an individual here taking his vaccine. Still, after he takes his vaccine, he continues with his social and physical distancing, wearing his mask, and continuing hand hygiene and all other hygiene measures. It's important for us here in St. Kitts and Nevis to adapt to what is needed in order for us to reach that herd immunity needed. Please feel encouraged. I am also one of the candidates to take the AstraZeneca, even though I prefer the Pfizer, but the AstraZeneca is just as good for me. That's why I will tell you why the Pfizer is a preference. Thank you, Mr. Williams.
What Mr. Samuel should have told you is that the Pfizer is a blue pill. Maybe that's why he's interested in taking it. Okay, we thank you, Mr. Samuel, for your presentation. We have quite a number of questions today, and we will start the ball rolling. The first question is from SKN Newsline. Why is there a lagging information presented by the task force on matters such as quarantine breaches? Shouldn't the public be informed immediately on such critical situations? Mr. Superintendent.
When there is a breach in quarantine that is identified, the first thing that the task force does is not to run to the mic and announce it, but we run to the place where the breach was identified and put measures in place to contain the breach. We do an extensive contact tracing to make sure that we identify anyone and everyone who would have been potentially exposed, to make sure that we contain the virus. And it is because of the diligence and the quick action of the task force over the last 12 months in managing this pandemic why we have not had any community spread to date. We, however, inform you in a timely manner. Initially, at the start of the pandemic, we had these briefings on a daily basis. We now have them weekly, and we attempt to inform you in a timely manner whenever there is a breach and what was done to contain the breach.
Thank you, Dr. Wilkinson. This question is from ZIZ. Regarding the plan for vaccinating the population, when would vaccination of the general public, non-frontline workers, and non-elderly begin? And also, is the vaccine you're receiving given in multiple doses over time? I think that was addressed in the presentation. If so, what happens if you miss your appointment for the second dose? Dr. Laws.
In terms of the rollout of our COVID-19 vaccination plan, we are focusing right now on educating the public, providing you with all the detailed information about the AstraZeneca Oxford vaccine, and then the actual date of first vaccination will be announced at the soonest.
This question is from Vaughan Radio. According to the CDC, Center for Disease Control, or Centers for Disease Control, the Pfizer-BioNTech vaccine may cause anaphylaxis in persons who are more prone to allergic reactions. When frontline workers begin to receive the vaccines, will those more prone to allergic reactions be exempted from taking it until a different vaccine is made available, or to ensure all frontline workers are vaccinated with epinephrine be available as a precaution as recommended by the CDC? Dr. Laws.
Very good question, Mr. Williams. And so when the Pfizer-BioNTech vaccine was rolled out in the United Kingdom and the USA, it was associated with a few healthcare workers who had or experienced anaphylactoid reactions. And so, yes, that's why we are advised when you receive any vaccine, you need to remain for at least 15 minutes unobserved just to make sure, you don't experience a reaction of this nature. Also, our vaccines will be rolled out in our health centers, and each health center is going to have a well-equipped emergency tray that prepares them to deal with any eventuality, including somebody coming down with an anaphylactoid reaction. And so the AstraZeneca Oxford vaccine to date is not really associated with anybody coming down with an anaphylactoid reaction. However, it's always important whenever you're going for any vaccine, the nurse or the physician, they usually engage you and ask you a number of questions just to make sure that you do not have any of the contraindications for that vaccine. And so that will be done in this regard.
Okay, this next question. With respect to the COVID vaccines, which require 2 doses, how effective is the vaccine over the time period between the first dose and the second dose? Dr. Wilkinson.
I can't remember the exact initial figures, but the first dose will offer more than 60% protection, and by the time you get to the second dose, it gets to over 80% for the AstraZeneca and over 95% for the Pfizer-BioNTech and the Moderna.
And this is our last question comment for today. I note that the executive arm of government is about third in line to receive the vaccine. I believe, though, this is the comment part, I believe, though, and would strongly suggest that persons in the executive arm and all of the parliamentarians should be part of the first category to receive the vaccine. Let us consider a scenario where, God forbid, a parliamentarian becomes incapacitated or even dies from COVID. The country would be placed under much stress and uncertainty, and of course, a by-election would have to be called. Any thoughts from anyone? I was told it's noted and would be taken into consideration, and that is the answer. That brings us to the end of our COVID-19 briefing for today. I want to thank all of our listeners. We thank all of you who continue to be vigilant, to pay attention to what is happening with the management of the COVID-19 pandemic. We thank you very much for continuing to adhere to all the safety and health protocols that have been put in place for our own safety. And of course, we encourage you, now that the vaccines are coming on stream, to avail yourself to take the vaccine. There is still some vaccine hesitancy and so on, but the scenario that the Chief Medical Officer placed before you today, which would you prefer? to expose yourself to COVID-19 and get severely ill and die, or to take the vaccine and be in a better position to deal with even if with that scenario. I want to thank Mrs. Christmas Jacobs for her continued service of sign language. We thank ZIZ and all the media who continue to play a pivotal role in terms of the accurate and timely dissemination of information, which is so crucial to the management of anything, but in this case, the management of the COVID-19 pandemic. We thank Dr. Laws and Dr. Wilkinson and Superintendent Henry and the National COVID-19 Task Force, who have been working very hard. There are a number of things that you do not see, but basically the task force has managed very well the COVID-19 pandemic here in St. Kitts and Nevis, and that is why we are seeing the results that we are seeing. Whenever there is extremes and excesses and people want to do all kinds of things, they have to pull back and they have to say, look, we are still in a pandemic. So much so that some people don't like it, but that is just the reality in which we live. We do not live at this moment in ordinary times. These are very extraordinary times that calls for extraordinary measures. And so the task force has had to be hard on certain things, but it is for our own good. It is for the common good. So we say thank you to the entire task force, all the persons who are on the front lines and doing what they're supposed to do, and all of us who continue to be vigilant in this pandemic. Thank you very much. Next week we will be back with another COVID-19 briefing. Until then, take care.
Is on.